So then what are some of the recommendations that you'll make early to patients? Because obviously, it's non-alcoholic fatty liver disease, but obviously alcohol is playing a role in fatty liver, as well. But then there's a dietary pattern. So what are some of the things that you recommend early on to patients, and how do you get them started?
Yeah, I mean, that's a great point about the alcohol. And there's been conversation about changing the name of NAFLD to metabolic associated fatty liver, I think, is they're thinking of changing the name so we don't make it sound like alcohol is not important to pay attention to. But they came up with NAFLD to distinguish it from fatty liver that was caused mostly by alcohol. But you're absolutely right. Alcohol and other toxins have a huge impact on whether somebody progresses, if their fatty liver progresses, and how advanced it becomes. So we do have to pay attention to dealing with alcohol and getting an understanding of what our patients are consuming. But in addition, I'm really, like, when I'm looking at the matrix, some of the areas I really focus on is toxin exposure, because we know that toxins involving, I mean, they've done research on everything from pesticides to PFAS, those forever chemicals, to air pollutants, to air pollution. All of these things have been associated with increased risk of non-alcoholic fatty liver disease. So I'm thinking about, what is somebody's toxic load and how is their body detoxifying, right? We know that patients with a lower glutathione level have a higher risk for non-alcoholic fatty liver disease and the progression of it. So I'm paying attention to what is their glutathione levels, what is their markers of oxidative stress. And then I'm thinking about the microbiome, right? Because we do know there is a definite association between dysbiosis and fatty liver disease. So they've shown, we've known for years about the association with dysbiosis and high levels of lipopolysaccharides that come from these gram-negative bacteria, certain lipopolysaccharides, triggering insulin resistance and metabolic syndrome. And we know that this dysbiosis and high lipopolysaccharide levels have been associated with non-alcoholic fatty liver disease, right? There is that gut-liver axis, right? That communication between the liver and the gut that is always communicating. And when there is increased intestinal permeability, when there's leaky gut, it's more likely that these endotoxins, the lipopolysaccharides, other toxins from the gut can get into the body, can influence the liver, and increase risk of fatty liver disease. So we know that there's this association, and a lot of research is going into the connection between our microbiome and risk for non-alcoholic fatty liver disease. So I'm thinking about, okay, we've got the biotransformation, right, detoxification node, and we're thinking about dysbiosis, we're thinking about the assimilation and defense and repair nodes. And then, of course, I'm really paying attention to signs of insulin resistance. What's going, does this person have sleep apnea that's causing their insulin resistance? What is their diet like? Are they eating the sad, crappy diet? Are they not moving? Do they have sarcopenia and that's causing their insulin resistance? And so it's important, right, as we always are doing with functional medicine, is we're trying to figure out for that individual patient where they need to focus so we can get the best bang for our buck. So, for somebody, it may be, it might be their diet that's, they're eating a lot of refined and ultra processed foods. For somebody else, it may be a toxin exposure that's complicating this. I mean, we know that 43% of people with non-alcoholic fatty liver disease in the US are not obese. So we do know that obesity is a definite risk factor, but there's lots of other things at play given somebody's genetics, their toxin exposure and their microbiome. And so it's really kind of this really interesting area where where we can, by gathering, that good history, we can really get a sense of where we need to focus with that individual patient.
I'm so glad you mentioned that, because, in the last year, I've had a chance to spend some time in the lifestyle medicine community. And it's been really interesting because, obviously if you take a step back, you'd say, look, here's a disease that is being caused generally by what we eat, right? You can see, okay, well, fructose has gone way up and people are having too much fructose, and therefore it's listening to this thing. So the simple answer would be, well, let's just get them having less fructose. And in a certain percentage of the population, if you change the diet and you move away from, sugar, and you move into more healthy food choices, you would see improvement in non-fatty liver disease. But what you just shared, and thinking about the matrix and the nodes of the matrix, that's why, I believe that functional medicine will be the operating system of the future of care, is because there will be people who, if you take them and change their diet alone, that won't improve. And that's because there are these underlying, other factors that are affecting the insulin sensitivity. And you mentioned a couple of them, but I'm sure there's all kinds of feedback loops that are happening in everyone's body that might lead it to. And I really appreciate you sharing that, because I just feel like it's another reinforcement to me that while lifestyle medicine is really like this sort of 0 to 1, that is needed. And it's really exciting to see, how many organizations and systems and health systems are getting on board with lifestyle medicine, because it's so hard to argue with. There is this other layer that is necessary if we want to really get to the root cause of what's going on in the physiology of these numbers of individuals.
Yeah, right. I mean, I think that for some people, it's not going to be enough to just do lifestyle. And so I think sometimes some docs will say, well, it's not just lifestyle, because I'm seeing these cases of people that, it's not lifestyle. So it's both, it's all of it. And that's where I think functional medicine shines, is because we are really working on that personalized care and looking for that, for that individual person, where do we need to focus? And though everybody could, work to, remove high fructose corn syrup and lower fructose in their diet, and get rid of the ultra processed foods, and get more vegetables and phytonutrients to help support their detoxification system and balance their blood sugar and get better sleep and all that stuff. There's other things going on. We're seeing this explosion. This is not just lifestyle, right? We've got to be paying attention to the toxins we're putting into our environment, and how is that impacting things. We've got to be paying attention to the shifts in the microbiomes in us that have been going on, because of this explosion of antibiotic use 50 years ago, or, over the last 70 years. We've got to be paying attention to that, because that has really shifted us, and it is really part of this whole equation here.